welcome to the Melanin Initiative. In healthcare, there's often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space to ask your questions and share our nursing perspective without taking up too much of your time. Today, we're joined by our returning guest and our favorite trauma therapist, Kelsey Wilson, to discuss a new service she'll be offering in her practice called Eye Movement Desensitization Reprocessing Therapy. Today, we'll learn about Eye Movement Desensitization Reprocessing Therapy, or EMDR, what you can expect during an EMDR session, how you can select the right intervention for you, the benefits of extended sessions, treatment recommendations, and how you can prepare for an eye movement desensitization reprocessing therapy session. If you are new here, welcome to the Melanin Initiative. I am Alicia Brown and the co-host of the Melanin Initiative along with Kimberly and Geraldine. We are a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about the ability to obtain information, to understand that information, and to use that information to manage your health and advocate for others. By watching on YouTube or listening on your favorite podcast app, we hope you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. If you haven't already, subscribe so you can be notified of when we release new episodes. Thumbs up the video and leave a comment or two. It helps us help you. It also shows YouTube the content is valuable and helps to make sure YouTube shows our content to those that need to hear it. And as a reminder, here's our disclaimer. This show is for educational purposes only. The opinions expressed are our opinions alone. They are not a representation of any of our affiliations. If you are experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you are having a physical emergency, you can call 911. If you're having a mental health emergency, you can call 988. So Kimberly, let's get started.
Well, first of all, welcome back, Kelsey. Thank you so much for agreeing to participate in season 3. Yes. You've been with us since the beginning, and we really appreciate it. We're really excited to have you back and hear more about how your practice is growing. You're going to be coming on twice this season to tell us about 2 new services that you're offering. But before we jump into the question, how's life been? How's practice?
Things have been going well. I'm happy to be here, and thank you for having me back on.
Yeah, super excited to learn about these 2 services because I'm not familiar with them at all.
Me neither.
Yeah. Okay. Are these like 2 new popular? I guess, yeah. What kind of got you to want to go in this direction?
Yes, so for background, I have an online private practice. Recently started doing some in-person services for women who have experienced childhood trauma. And so EMDR is an evidence-based practice that a lot of people have gravitated towards because of how effective it is. And so when I saw the opportunity to learn more about EMDR, I definitely wanted to do that so I can serve my clients better.
Yeah, and actually, if you haven't already, go back to seasons 1 and 2 and catch Kelsey. She joined us last year for Juneteenth, where she talked about intergenerational trauma. Then she returned in season 2 to talk about anxiety, depression, and suicide. Some really heavy topics, but really important ones for us to bring to the public. And so you talked about the training. What did that involve?
Yes, so did a several day EMDR training with a lot of different therapists from across the country who wanted to learn more about how EMDR can help a wide range of mental health diagnoses and concerns. And so a lot of people think that EMDR is just for trauma, but it actually can be used to treat depression, anxiety, distress related to like discrimination or OCD or a wide range of mental health and substance use diagnoses as well. So
discrimination.
Yeah.
Like
distress related to discrimination.
Interesting. Wow. Well, let's learn more about it. Okay.
Yes.
So, what type of therapy do you have? What type of therapy practice?
Yes. So I have a private practice that focuses on serving women who have experienced some form of childhood trauma in their lives and now are experiencing anxiety, depression, trauma, PTSD. or life transition issues or burnout, and just, having difficulty navigating life, the workplace, and trying to build healthy partnerships and things of that nature. And so last year I was primarily doing online services, but now this year I'm offering some in-person services in Reston, Virginia, for therapy intensives, which we're going to talk about today.
Okay, great. And we'll have all her contact information in the description box, as well as the links to her previous episodes.
All right, so we've been saying eye movement desensitization processing therapy a lot. Can you tell us exactly what it is?
Yes. So EMDR, it's an evidence-based practice that helps individuals who have a wide range of mental health concerns be able to process trauma from a different lens. A lot of times people will walk through their entire lives dealing with the side effects of trauma, but what EMDR does is it helps bring down the distress to a level that's tolerable or completely no longer an issue. And so that's why a lot of people gravitate towards doing EMDR, because it really helps with looking at the distress from a different lens. And so kind of different from different interventions where it might just specifically be geared towards PTSD, EMDR focuses on a lot of different areas and helping you to feel more calm about things that have happened to you from the past.
Interesting.
And what are therapy intensives?
Yeah, so with therapy intensives, it just offers more time. So right now, a lot of people go to therapy for a clinical hour, which might be 53 to 55 minutes. But some people really don't have the time to be in therapy weekly, ongoing for 6 months to a year or longer. They really want to come in and be able to do a 3-hour session with a therapist who's trauma informed, who can help them to break down some of the issues that they have so they can get back to their life and really getting on track with where they want to be and not feeling as distressed about some of the things that they've been through. And so EMDR is a little bit different than the traditional therapy where you would do talk therapy. EMDR focuses on eye movements, taps, and sounds. And so I can teach you all a tapping exercise.
Free therapy. Real curious, this sounds kind of advanced because you're saying they have trauma, so it seems like before that stage someone had to diagnose or identify the trauma, right?
Well, so I have different clients who come in different ways. So some people might come in and they already have a previous trauma diagnosis, a PTSD diagnosis, or maybe they just know that they were either sexually, physically, or emotionally abused as a child, and they want to first identify like what it is that they're going through, whether that's like depression as a result of that or whether it's actually PTSD. And so I diagnose clients to see what it is what's going on during the initial session, and then from there we would build out a treatment plan to see if EMDR is a good fit or if we should be doing something else.
So it wouldn't be like your first visit?
To determine the diagnosis or to determine what treatment?
Like this particular therapy, it's not like, oh, my first time ever to a therapist is to do EMDR.
So when you're working with a therapist that is EMDR trained, from the very beginning, they're using that lens to be able to kind of talk through the history taking. And we'll go through all the 8 phases of EMDR so everyone has like an understanding of how EMDR works. But when you're working with a therapist who's trained in EMDR from the very beginning, they're already talking to you from that lens.
So the patient, are they making that request?
Sometimes, but then other times maybe a client isn't aware of EMDR, and then you can like educate them like this might be something you want to try out.
Okay.
I also heard you mention one other thing about like the timing of EMDR and like other therapies that may require you to be consistent on like a 6-month to a 1-year basis. And I like the fact that this is a therapy that could be more shorter term and kind of meeting the patient where they are and their needs.
Yes.
So what is an EMDR session typically like?
Definitely. So this is a time where we can go through all the 8 phases and teach people what they can expect. So with EMDR, when you're first getting started, the therapist is doing history taking and treatment planning so that they can gather information about your history and assess your readiness for EMDR. And during that time, a treatment plan will be developed that's person-centered and geared for you. After that, we would go into preparation stage where we would explain EMDR, help you develop skills for managing stress and emotion. And during this phase, we're really building up like a therapeutic rapport with the client to help assess, do you feel comfortable in the session? Are you ready to kind of move to the next stage? And also, do you feel safe in therapy? Next, we would move to assessment. So we would identify a traumatic memory or target. And EMDR is all about targets. So someone might have several targets throughout their lifetime that we would try to work on. But the touchstone memory is the earliest memory of distress that a person would have. And we really try to figure out what that touchstone is, because that can play a role in future targets that we work on and bringing down the distress for those. So that's really important during the assessment phase. Then we would move on to desensitization, and that's a really important part of EMDR, which involves the bilateral stimulation, eye movements, taps, or sounds. And so one of the tapping exercises that I teach my clients is called the butterfly hug. And if you all want to try it, you're welcome to. And I don't want to cover my mic here.
Oh yeah.
But you would you can loop your fingers, or if you feel more comfortable just doing it like this, you can do it like this on your chest. And you want to ground yourself in your chair. And you really want to focus on your breath. And you can gaze at a soft spot in the room where you feel comfortable. And you would just lift your hand, and at a pace that feels comfortable for you, just going back and forth, doing bilateral stimulation. So one at a time, side to side, as you breathe in and out. And when I'm working with a client, I would be having them to think about a specific target memory as they do the tapping and go from side to side. So that's one way that you could do this. Some clients gravitate towards the tapping because that feels comfortable for them. Others like the eye movements. And I use an app which shows a little ball, and it goes across the screen. And they don't move their head, they just keep their head in one position, and they move their eyes as they think about the target memory as they go back and forth. And in between sets, I'll ask them like what they're noticing as they think about that memory. And we kind of go through the process of seeing what they're noticing, and your brain can really take you anywhere, because you think that you're thinking about this one target, but your brain can kind of take you to something else. And you tell the therapist like what you're noticing as you do that by BLS, bilateral stimulation.
So the bilateral is with the eye movement too? Because you're going side to side?
Yep, side to side, and then tapping side to side.
You're still tapping with the eye?
You could do tapping, or you could do BLS, or you could do both.
Oh, you can do them both at the same time.
Wow, I was already
right. I was like, that's a lot. Yeah, so some people like one or the other.
Oh, yeah. As well as a beginner, right?
Yeah. Yeah. And then there's also sounds, and so the app that I use allows me to like turn on a sound, and if you're doing the eye movements with the sound, you'll kind of hear like a ping pong type sound, kind of going back and forth to keep you on track. Some people use their fingers, therapists use their fingers, and they have their client follow their hand as they go back and forth, and you change the pacing depending on what type of memory or what you're trying to install. So
install. What do you mean?
Yeah, so sometimes in EMDR we're trying to install a positive cognition or like a positive thought that's a resource, and so we would have them install that while they do BLS with eye movements, taps, or sounds.
Interesting. So do you like say picture yourself at the beach?
Yeah, so you could picture yourself at the beach if that's a calm state for you, and then you could install that by doing eye movements, tapping, or sounds while you think about that memory.
I see. Okay.
Or resource. So that's about desensitization, and then we actually moved into talking about installation, which is the next phase here. So we use BLS, which is bilateral stimulation, to strengthen a positive belief, and then we can go into body scans. So that's where you would check on the client and ask them to focus on their body and noticing any tension or discomfort or any lingering negative sensations, and do additional bilateral stimulation to address them. And then we would move towards closure, and this phase ensures that the client leaves the session in a state of relative calm. So relaxation techniques may be used, and the therapist checks if there's any unresolved issues. And one of the exercises that I teach my clients is called container. And that's an exercise where you put all of your distressing memories, all of the anxiety, all of the maybe things that make you feel sad into a container. It's like a guided imagery exercise, and then you put a lid on top of the container that you choose, and you can bring that container out when you come to therapy, open it up so we can talk about it, and then at the end we put the lid on the
I
container.
really like that.
I love that.
Why that appealed so much, but it did. It did. I really liked that.
Yeah, and clients really like that one because it just really allows them to kind of focus. And you can close your eyes while you do that exercise, and they really find that that's like relaxing to them when they do that.
Just hearing about it was like comforting.
Yeah.
Yep, and so that's kind of the closure. And then at the beginning of each following session, we would assess progress made, ensuring that changes are stable, and it also determines if there's any other memories or targets that we want to try to focus on for that following session. So that's kind of the stages of EMDR.
Okay, so who's an ideal candidate?
Yeah, so for someone who's coming to work with me in private practice, an ideal candidate would be someone who's motivated for change, who really wants to feel better and do an intervention that's a little bit non-traditional. So EMDR does involve some talking, so I don't want it to be like, oh, EMDR doesn't involve any talking. It's just different than talk therapy because that's not the primary method, because you're doing the eye movements and the tapping and the sounds. So a little bit different than talk therapy. And I do have talk therapy clients within my practice. It's just some people find me and they specifically want to do EMDR, or they would really benefit from EMDR, and I make sure that they know that.
So what are the benefits of extended sessions?
Yes, definitely. So for clients who are really tight with time and they really want to focus on a specific target memory and receive help for that, an EMDR therapy intensive would be a good fit. Say you're not able to commit to working on this issue that you've been dealing with for a long time, over the course of 6 months or longer. You really want to come in and do a structured approach to trying to address that issue within a 1, 2, or 3 day period, and meet with me for a couple of hours to try to work through it. So in the treatment planning phase and also in the consultation call, I would ask if we're working on something very specific. So are you having anxiety attacks and you want to work on trying to reduce the anxiety attacks? Are you having panic attacks? Is it working on self-esteem that you want to try to target, or a single incident trauma that you want to focus on? If it's more than a single incident trauma or one specific target, it might be better to do traditional therapy. So I make sure that my clients know what method might be the best when they do a consultation call with me.
Okay.
What are treatment recommendations?
Definitely. So in terms of EMDR, the treatment length of time can really vary depending on what it is that you want to work on. And so a lot of my clients may be a good fit for multiple intensives if that's something that they want to do because of their work schedule or just because of the timing that they're looking to spend on therapy. Or they might want to do traditional therapy if that's a better fit for what they're looking for, which would be hourly sessions over the course of however long it takes to work through the things that they want to target.
So what are common misconceptions about EMDR?
Definitely. So there are definitely some misconceptions out there about EMDR. Some people may believe that it's hypnosis, but in reality, EMDR is more so focused on neuroscience and what it does to the brain, because it's really targeting the amygdala, which focuses on emotion and reprocessing memories. And so when we're doing the bilateral stimulation, where we're going from one point to the next with the eye movements, the taps, or the sounds, what we're really doing is mimicking REM sleep. And that's the phase of sleep where we're processing all of our memories, all our thoughts and emotions at night. And so we're just doing that in a structured form during the session. So that's a misconception. Another misconception is that it will make you forget about your trauma, which isn't true. It just lessens the distress about your trauma. So that can be really helpful because some people don't want to forget the past. They just want to feel differently about the past. And some people do want to forget the past, but EMDR doesn't make you forget your memories. It just helps you to feel differently about your memories. And also that EMDR is exclusively for PTSD. That's a misconception. It's actually used to treat a wide range of mental health concerns and substance use concerns as well.
Okay, let's talk about money, Kelsey.
Okay.
Because this sounds pretty advanced and the sessions are longer. So,
Who's paying for this?
yeah.
Yeah, so the cost can vary, and it really depends on if you're wanting to utilize insurance or whether you're doing private pay or you have an organization paying for your therapy. So I talk about all of my clients' options during the consultation call. My consultation calls are free, and they can schedule those, and we talk on the phone for 15 minutes to decide what approach we should take in terms of whether we should do traditional therapy or therapy intensive, so that we can pick the best option for you. So I encourage everyone to reach out if they have a question, and I also work with a lot of different therapists who do different type of trauma modalities. So if I'm not the right fit for you, I love to be able to give referrals too.
Wonderful.
That's great. So where can people learn more?
Definitely. So please reach out on my website, kelseywplc.com. You're welcome to follow me on Instagram, Kelsey Wilson PLLC. I'm also on Threads, Kelsey Wilson PLLC.
Okay.
All right, Threads.
I wasn't expecting that.
Yeah. So please do.
Got you covered.
Yeah. That was good. That was intense.
Yeah. I would say, Kelsey, you definitely taught me something today.
Yeah.
I had never heard of EMDR, so thank you.
I'm really impressed that patients even know it exists, but they do sometimes more research than we do.
Right.
So that's probably
Yeah.
Yes, and one thing I'll add is that some people do EMDR after they've tried other modalities that haven't worked. And so if you've been in talk therapy for years and you're noticing that it's not working or you're still feeling the same symptoms, EMDR might be an approach you want to try to take to experience some relief. So I want to encourage those out there. If you've tried other things and it's not working, EMDR might be the better fit for you.
Awesome.
Thank you.
All right. So today we talked about eye movement desensitization reprocessing therapy, or EMDR, what you can expect during an EMDR session, how you can select the right intervention for you, the benefits of extended sessions, treatment recommendations, and how you can prepare for an eye movement desensitization reprocessing therapy session. So as always, we want you to connect with us. You can email us your questions or show ideas at tmi.melanin@gmail. If you haven't already, subscribe to our YouTube channel and follow us on every social media platform. Say hello in the comments when you get there. Please share the show with your friends, rate the Apple Podcasts and Spotify, and leave a comment. It really helps the show get more support and gets the message out there to those who need it. You can find all of our social media links and a list of resources related to our conversation today in the description box. We release a new show weekly on TMI Tuesdays at 10 a.m. on YouTube and all your favorite podcast apps. Follow, like, and share our content with all of your friends. Thank you for watching.
Bye.
We'll see you next time.